25-year-old woman with sudden weight gain, irregular menstrual cycle, and acne. Everyone thinks it is PCOS, but the real problem is much more dangerous. That is Cushing syndrome. Let's understand what happens when cortisol goes out of control.
Cushing syndrome is excessive activation of glucocorticoid receptors caused by overproduction of cortisol by adrenal tumors, pituitary, or ectopic causes. This is the HPA axis in which hypothalamus secretes corticotropic releasing hormone, which stimulate the pituitary to release ACTH, which further stimulate adrenal gland to secrete cortisols. So this is ACTH is released from pituitary. There are the causes. I have already said about the causes: overproduction of cortisol by adrenal tumor, pituitary, and ectopic. So we can classify it into ACTH dependent, non-ACTH dependent, and pseudo-Cushing. In ACTH dependent, it is due to either pituitary or any ectopic causes. So it needs ACTH to cause Cushing syndrome. So it's called ACTH. For example, small cell carcinoma of the bronchus, carcinoid tumor, neuroendocrine tumors, in which both ACTH and cortisol levels are elevated. Whereas in non-ACTH dependent, it doesn't need ACTH. Here the problem is in adrenal. So without the help of ACTH, it can secrete cortisol. So in non-ACTH dependent, it contains adenoma, adrenal carcinoma, and McCune-Albert syndrome, in which only the cortisol levels are elevated. ACTH is either normal or decreased. In pseudo-Cushing syndrome, we have alcohol excess or any major depressive illness or primary obesity. So these are all the causes for Cushing syndrome.
Clinical features of Cushing disease. Let me explain the reason behind all these clinical features. Okay, first we will see there will be hyperglycemia, buffalo hump, and thin extremities. Because normally the cortisol is a diabetogenic. Hormone. Diabetogenic hormone, which means there will be increased blood glucose level always in the blood. It also cortisol also result in increased lipolysis, that is breakdown of lipids, and there will be increased protein breakdown also, protein catabolism. So in blood there will be increased lipid always. So these fat will deposits on back of the neck, which result in buffalo hump. Whereas due to protein catabolism, the muscle will lose and lead to thin extremities. And due to diabetogenic effect of the cortisol, increased blood glucose, there will be hyperglycemia. And there will be bruise, petechiae, thin skin, and purple striae. These are all due to loss of collagen. Because of loss of collagen, the blood vessels will be very fragile. They are loose on the muscle. So they are very vulnerable to touch. So even on touch they bleeds. This is the result for bruise, petechiae, thin skin, purple striae. Loss of collagen is the main reason for these clinical features. Then there will be mineralocorticoid like activity. There is a high cortisol level. High cortisol glucocorticoid can act like mineralocorticoid. So there will be increased H plus and K plus loss will be there, and sodium and water retention will be there. So this result in edema. Okay, whereas this result in hypokalemia. Okay, there will be hypokalemia, and due to this there will be alkalosis, because the increased H plus is there, right? So it result in alkalosis. So in patient in In Cushing patient, there will be hyperglycemia and hypokalemia, alkalosis, and due to sodium and water retention, there will be edema. These are all due to mineralocorticoid like activity of cortisol. And in a male patient, there will be gynecomastia because the testosterone production will be decreased. In female, there is amenorrhea and hirsutism, and there will be osteoporosis because of decreased osteoblast activity. And there will be increased infection because there is a suppression in WBCs. So they are more prone to infections. And there will be personality change and CNS irritability because these cortisol have effect on, or it affects the neurotransmitters in the brain, which results in personality changes like anxiety, depression will be there. These are all the explanation for the clinical syndromes.